Well, hello everyone, and welcome to our COVID-19 Resource Forum for Seniors. I'm Councilmember Paul Krekorian, and I have the privilege of representing the communities of the East San Fernando Valley, and I also serve as chair of the City Council's Budget Finance Committee. And I'm very pleased that you could join us for this discussion about resources that are available to seniors in this very difficult and trying time. I'm joined by some of our real experts in the city of Los Angeles and the county of Los Angeles on senior issues and on the impact of COVID-19 on seniors right now and the resources that are available to help address those impacts. Representatives from our city, our county, and our state government. And I'll be introducing them in a moment, but I'm very pleased that you're able to join us for this discussion. Obviously, the COVID-19 crisis has created an unprecedented time of disruption for all of us, a time of uncertainty and confusion. And in times like that, people want to find out clear information. They want to find out answers to their questions. They want to see how government is continuing to function and provide services. And that's what I hope you'll be hearing throughout the course of this forum. And for all the challenges that we're facing, and they're extraordinary right now, the challenges are especially acute for our senior population because we all know that the health impacts of this virus disproportionately impact seniors. And so those of us who are over 60 need to be especially concerned about those health impacts. But that also impacts so much else in our life because it causes us to have to take precautionary steps that maybe causes us to be more distant from our support system, more distant from our usual way of doing things, more distant from government services. But the good news is that at every level of government, your representatives are finding ways to make sure that you have the services that you need, even in these very trying times. And that's why I'm so pleased we could bring our experts together today. And I'd like to start our discussion right at the top. Our representative in Sacramento, Assemblymember Adrien Nazarian, who represents much of the San Fernando Valley as well as the Hollywood Hills. Assemblymember Nazarian has been representing us since his election in 2012. And not only does he represent a significant part of our city here and my own San Fernando Valley, but he also chairs the Assembly's Committee on Aging and Long-Term Care. He's a member of the Health Committee. He's a member of the Transportation Committee, and very importantly right now, the State Assembly's Budget Committee. And as the city's budget chair, I can definitely commiserate with the challenges that Assemblymember Nazarian and his colleagues have in trying to come up with a balanced budget that will meet the needs of the people, given the impact that COVID-19 has had on state and local revenues. So he'll be talking about that, I hope, as well. But I'm very pleased to be able to recognize him, and I'd like to start off by asking you, Assemblymember, if you could talk a little bit about some of the challenges that you're facing right now, how COVID-19 has impacted the state budget, and then maybe as well, you can talk about some of the things that the state is doing to support seniors in this very challenging time as well. So I'm very pleased to welcome you, Assemblymember Nazarian.
Thank you, Councilman. It's always wonderful to join you and to partner up with you on whatever the challenges may be. And looking forward to working with you closely as we deal with a lot of these issues head on and try to come out the other end being able to provide for our constituents not only the information that they need, but also hopefully being able to manage the budgets, both the state and local budgets, these are the times that you wish you had the capacity of the federal government to just print money and be able to alleviate some of the issues that way. But because we both have to balance our budgets, there's challenges. So just to put things in context, and I want to briefly give a summary of what's going on in the state, and then what my office has been doing and where we go forward from here. We were at an all-time high up until literally about 2 months ago. Ever since the 2008-2009 budgetary years, which you remember very well, Councilman, as you were in the state legislature at that time, and we had to make severely deep cuts and eviscerate long-standing programs that were not protected, but were those gap programs providing much needed social service safety net where the federal government wasn't covering. And so it was borne on the state's general fund in order to pay for those services and programs. Well, over time, over the course of the last 12 years, we've been able to climb out of that, reinvest in many of these programs. Some of them have never gotten reinvested in, but we've repurposed, retooled, looked at where the priorities should be, and we've made some changes. And along the way, we've tried to also help, especially the disabled communities, the developmentally disabled communities, and the senior and aging populations. Yet, unfortunately, now with the pandemic expediting the economic downturn that we were going to have anyway, but just completely taking 1/5 of the state's budget, our budget had grown to roughly about $250 billion in the state. We're now looking at a shortfall of about $54 billion, roughly 20%. Just judging by those numbers, you know that what's going to end up happening is those programs that are protected are going to continue getting their funding. Those that are not protected do not have their own revenue streams, protected revenue streams, are going to get severely cut because there's just so much general fund to go around in trying to fill the holes that are being left. So just to give you a bit of an example on what's going on the aging community front. The governor just brought forward his May revise, and it looks very different than what he had presented back in January. Now we're looking at cutting the Mssp program, which is a multi-service senior program. This was a program that was at $22 million a year. It helped provide services for seniors with most needs in centers, and it was a wraparound service program that had been doing very well. And we had just been successful last year in pushing another 15 million into the program and expanding it. It has 10,000 slots throughout the state at a total cost of 22 million. That program is going to be gone as of this budget. CBAS program, which as you remember used to be the Adult Day Health Center programs, roughly about $1.6 billion, 60,000, supporting 60,000 slots. This budget is recommending that entire program would be completely cut. Now, let's not forget also that this is the program that at roughly $72 a day of participation ensures that our seniors who are going to these centers getting actively engaged, exercising, getting nutritious meals, avoid a $7,000 a night cost at a hospital because of the lack of not checking up on them or their vitals. So this has been a great program in prohibiting big major costs. Senior nutrition program has been cut into half, from 17.5 million down to 8.5 million. Ironically, in this area, food banks received an injection of 50 million this year because of what was going on. Now, what's interesting is that we're basically making investments in food banks, which cater to the needs of the general public, but eviscerating the senior programs. So I bring these up because these are going to be issue areas that we're all going to need to work on and collaborate together, whether as advocates or public officials, in partnering and figuring out how we message this to the governor. A couple of other programs that I just want to mention: Caregiver Resource Centers lost 30 million, which were going to be placed in over 3 years. This program had only about 5 million, but as we saw the growing needs of seniors and who care for their spouses, I fall into that category, as my mother is taking care of my father, who is suffering from Alzheimer's. And as difficult as it's been for me to get her some support and some respite care by having someone come in to their house, now that she's willing to get that support, this program is going to be cut. So this is where this program was helping, and yet unfortunately it's now going to be cut. Last but not least, another example is the Ombudsman program, which is going to have about $1 million cut. The Ombudsman services are for families and of loved ones who are in nursing homes, and they help advocate for those in nursing homes. A budget is supposed to reflect the value of a society. Where you put your money demonstrates what you're prioritizing. And unfortunately, what's happened with this budget is that there are so many large components to the budget that are already protected, that the most vulnerable populations that rely on the most insecure source of funding are going to be receiving the harshest cuts. I just wanted to emphasize that, not to make it into a doom and gloom situation, but I wanted to emphasize that because it's critical that moving forward, we need to demonstrate to the governor and to this administration that as the Human and Health Services Agency's budget numbers, in fact, if we can put up that slide so that we just give a small brief overview of all the cuts and some of the increases. It's not exactly the slide, but here it comes. So when you look at this, this roughly outlines all the various agencies at the state level and what the budget was last year, what the budget is going to be this coming year. And as you can tell, we're taking a severe hit. It's a total of negative 12 billion at the bottom, which of course is less than what I said before, but this is just a snapshot of some of the places, some of the areas. If you look closely, you'll see that the only place that's growing is Health and Human Services Agency, which the aging department falls under. Now, we're technically supposed to be, if the entire budget is taking about a 20% cut, all agencies and areas of service should be getting somewhat of an equal cut. But if you notice, certain programs within aging were entirely being eviscerated, even while Health and Human Services Agency is the only agency that is seeing a growth in this budget. So I just wanted this to be a snapshot for our viewers to have numbers, precise numbers to look at, and we can talk about this a little bit more later. But the other slide that I wanted our viewers to see was one of the things when you're on budget committee and you look at the long-term health of the state's financial circumstances, is you look at the daily receipts of money coming in. And as you can tell, this is literally daily updated. You have the numbers from personal income taxes, you have the numbers from the corporation taxes coming in, and you have the total remitted. And then as you can tell at the bottom, there are tabs that say this is the snapshot of May 2020. There's a snapshot of May 2019. If you look then at the bottom numbers side by side, you will notice that the May 2020 numbers of, for example, personal income are at 1.4 billion receipt. Whereas when you look at the May 2019 numbers, they're gonna be, well, I had it reversed. So that's 1.1 billion, while in 2020, we got roughly about a third of, uh, less than half, almost a third of that coming in. So this just draws a picture of where we are with revenues. Now, there have been extensions put into place to offer the relief that many of our California residents and LA City residents want, but at the same time, this gives you a snapshot of how slowly the revenue dollars are going to be coming in and how difficult it's going to be to pay for services. And so one point that I want to make sure that we focus on is that it's times like this when various advocacy groups start cannibalizing one another and go retreat into their silos and start protecting their turf. We need to make sure that we don't engage in that practice and that we figure how everyone can live with their piece of the budget pie and make sure that everyone has an equitable amount that allows their services to be provided. I focused on aging because I chair the Aging and Long-Term Care Committee. And when you look at where California is headed, right now, the aging population of 60 years and older comprises 12% of the state's population. In 15 years, just 15 years, 1-5, not 50, in 15 years, that number is going to more than double to 25%. So with that comes a great deal of need for care, IHSS, nursing facilities, palliative care, you name it, all of the areas where we have the most vulnerabilities, where currently we're stretched for dollars, and also don't have enough employees filling the slots that we have needs for. You can just imagine how much more that's going to grow over time and all the costs associated with healthcare needs. So that's just a quick snapshot.
Well, and it's a very sobering snapshot when we see that incredible decline in revenues that the state government has to deal with. And yet at the same time, the demands for services right now because of COVID-19 are spiking. So the expenditures that the state is being expected to make are going through the roof. And let me just say from the city's side, how much we appreciate the work that the legislature and the governor have done to be able to support some of the very important initiatives we have going on in the city to support seniors, to support healthcare, to support our economic recovery, lifting up our small businesses, and the many other things that have been done on a very emergency basis to be able to keep the city moving forward. But that comes at great cost. And I think we all need to be mindful of the fact that it's going to be a difficult few years, both at the state and local level. And you're certainly right, Assemblymember, that I think advocacy with the governor is certainly important, but advocacy with our federal officials is probably even more important for everyone to let their members of Congress know how important it is that Washington, which has the ability to address these issues with additional funding, provides that to state and local governments. I wanted to ask you, a number of my constituents, our common constituents, have called my office with similar kinds of questions. And one of those is that very sadly, whenever there's a time like this where people face uncertainty and where there's money that's being provided to certain programs, there are always, unfortunately, an element of our population that tries to take advantage of people, that tries to scam seniors out of those checks that they may be receiving, or otherwise fool people in ways that are exceptionally despicable, especially at a time like this. Can you talk a little bit about, what sort of scams you're aware of that may be targeting seniors, and what should people do to help protect themselves against that, or what resources are there available to them if they think that they have been scammed?
The resources are a little more challenging, but it's a great question. Thank you for bringing that up. We're hearing a lot of this right now happen. 3 general areas that we're seeing and hearing are vaccines, charities, and then cures and services. So as for vaccines, there are no vaccines. No one can sell you a product that's gonna offer you the shield necessary from COVID-19. There are multiple drug companies that are advancing their research, and there are test phases taking place right now. In fact, there's a couple of drugs that are now entering their second phase. And I will be hosting, by the way, Councilman, would love to have you participate. I will be hosting a healthcare forum on this, talking about what drugs there are and what treatments there are available. That'll be coming up in a couple of weeks. But there are no vaccines right now. Our vaccine basically has been physical distancing. It's a very raw level of protecting ourselves. That's our vaccine, given that there is no drug or prescription drug that we can intake and be able to help provide us with the immunity necessary. Second, as for charities, there are multiple charities. I would suggest if there's anyone who wants to make a contribution, they go to the source directly and verify. And at that point also, they can always feel free to contact your office, my office, any of the elected offices, so that they can go directly to the source of where they need to be. Because a lot of these sites are also becoming very clever. They use a lot of the same font sizes and writing style in order to be able to fool unsuspecting eyes. So it's critical that you should feel free to contact any of the elected offices to get the information you need. Last but not least, when it comes to cures and services, please don't hesitate to go to the LA County Health page. That is a great resource. Well, I guess as for resources, that would be one. Both the state has a website as well as the county. The county's dashboard is phenomenal because it provides you with all types of numbers of what's going on in LA County, where the hotspots are, and how does LA County compare to other major metropolitan places. And that's https://covid19.lacounty.gov/testing/. Again, it's covid19.lacounty.gov/testing/. You can also feel free to contact the city's aging department at 213-482-7252. And as always, don't hesitate to contact the councilman's office or my office. What I failed to mention in my opening remarks is that I have a wonderful team. My district staff is comprised of just 4 individuals. Emma Taylor is my district director, and my 3 field deputies, Stephanie, Logan, and Julissa, speak 3 languages amongst all of them. And they've been funneling literally upwards of 500 calls a week for the last 6 weeks. Between the calls, emails, Facebook messages, all sorts of ways of engaging us, we've been continuously just responding. In fact, all of our legislative efforts, for the most part, have slowed down, and my entire capital and district staff is just focusing on constituent services. You are muted, Councilman.
Thank you. I'm glad you mentioned that, because that actually brings me to my next point that a number of people have asked us about. During a time like this, where everyone is operating from a distance, City Hall is closed. We're conducting our meetings virtually like this. That makes it harder for people to get essential government services. And some of my constituents have been especially concerned about their driver's license. Even my mom even mentioned this to me, that her driver's license was going to expire, and DMV offices were closed. People don't know what to do. So what advice would you give to somebody in that circumstance?
All else fails, don't ever hesitate to contact my office. My staff is really loving me for this now, but don't hesitate to contact my office. 818-376-4246. But a quick response to that is that the DMV just announced that they will be extending driver's licenses for 120 days. Even if you have been someone that has not gone in to a DMV center for 15 years, they will go ahead and extend it for 60 days for you to not physically have to go in.
Well, that's great news. That's great news. And then I assume also if somebody is having trouble getting their unemployment check, anything like that, the first stop should be to call your office, or if they live in a different district, their state legislator's office, and they can be of assistance.
Yes, and we've had some mild success. I will just say that ever since April 28th, when the PUA system went in, the amount of calls, we literally registered, I think, about 1,300 calls in 3 days between the emails and the phone calls. And as you can imagine, it takes 9 people a certain period of time to be able to get to all of those calls and provide resolutions. So I ask everyone to understand that we are going to get to you. Please be as patient as possible. If you see that you can get in contact with EDD directly, great. We will get to you though at some point and try to resolve your situation. What we've actually done is respond to all 1,300 folks, and by way of email or letter, let them know that we're going to be responding to them, and we're slowly, for those that we have information through our database system, we're forwarding their comments and concerns to EDD. The other point that I'd like to make also is that we are going to be hosting a webinar or a town hall with representatives from EDD to figure out how we can address some of the concerns. And we're going to need to figure out how to do that as a call-in program.
Very good. Well, thank you very much, Assemblymember Adri Nazarian. Thanks for being a part of this. Thanks for the extraordinary work that you're doing representing all of us in Sacramento and facing up to the immense challenges that are before all of us now. I appreciate you being a part of this.
Thank you.
You know, here in the city of Los Angeles, we have a Department of Aging specifically dedicated to ensuring that the needs of our aging community in Los Angeles are addressed, to ensure that within city government, we have a source of advocacy on behalf of our aging population. And I'm very pleased that today, participating in our town hall, is the Assistant General Manager of the Department of Aging, James Dunn. And I'd like to turn to him now and welcome you. And I'd like to ask if you could start off by giving kind of an overview of some of the steps that the Department of Aging in the city of Los Angeles has taken to address the extraordinary needs that have come upon us so quickly because of the COVID-19 epidemic. And welcome. Oh, and I think you're muted.
Hi.
There we go.
Hi, thank you very much, Council Member. As you mentioned, this has been an incredible time for the department, for the seniors of the city. A lot of our normal programs that most seniors think about when they think about senior services, like senior centers, directly impacted right from the beginning. Currently, the biggest demand for services from seniors, of course, our meal services. We've gone from a combination of dining centers for more active seniors so that they can congregate and socialize with one another, along with our home delivered meals program for our frailer seniors who are basically homebound. Now, because of the pandemic, basically we're delivering all of our meals to the homes of seniors. And this has been a quite incredible challenge. Basically, we've doubled the number of seniors we're delivering meals to at the beginning. And we did not have the infrastructure or staff. So basically, all of our nonprofit agencies pulled from all of their various units to come up with the delivery staff necessary. The other thing that has always been a part of the city's emergency plan is the use of disaster service workers. That's basically the label that we assign to all city employees who are not essential to a department to maintain services to the public, and that different departments can borrow them in order to meet their service needs. And that's exactly what we've had to do. We've used a lot of disaster service workers in order to supplement the drivers needed to deliver the meals to the seniors, as well as people to answer all the phone calls that we've been getting. Just to give an example of, we were serving at about 104,000 meals per month combined prior to the pandemic. Last month in April, we were already over 140,000. And this is just for our previous clients in our normal programs that's funded under the Older Americans Act and the city general funds. This doesn't include the additional 13,000 seniors who have since signed up under the new Great Plates program. So there's been a tremendous pressure, and all these seniors are reaching out, because even though previously we have a lot of active seniors, very self-sufficient, but now that they have to, shelter at home to stay safe, their resources are very limited. So that's been one of the major things we're trying to do. And as the Assemblyman mentioned before, with his small but very mighty staff, our small department is also very mighty in how we leverage our resources. In the first week of May, we were taking over 3,000 calls per day. Just mainly it's all for meals. The only way we were able to deal with it is that we actually brought in 180 other city employees to help man the phones, to take those phone calls, to call seniors back. As a matter of fact, we had a dedicated 60 disaster service workers just to make the callbacks to keep the seniors informed. So that's a little bit of what's been
if I could just, I don't mean to interrupt you, but just so that people fully understand what that means. The disaster service workers are people who might normally be, say, a librarian, but the libraries are closed, or a rec and parks recreation specialist, but the recreation programs are closed. So they're being pressed into service. They're not just sitting around at home. They're going and helping the people in other ways as disaster service workers, for example, going to the Department of Aging to help meet those needs.
Exactly, and it's interesting you spotlighted those two departments, because they've been critical partners to us. The staff they've been sending over to help us out, delivering meals or answering the phones, they've been wonderful. They've been doing a great job, and I think the city's disaster service worker plan is working very well. We really appreciate all the assistance we've been getting. And as you mentioned, these are employees drawn from areas that may not be able to function because of the pandemic. It's the same thing in terms of our senior centers. Even though our senior centers are closed, they still have staff who are providing services to community. And that's the other component that we're providing to seniors. Our case managers are still working. And one of the vital services that they're providing to seniors right now is the daily telephone reassurance calls. Every day, the social workers at the centers and their support staff, they've been making calls to the seniors to make sure that they're okay, to provide them some sort of social interaction each day. Recently, because this has been going on for quite a while now, the department, we were very concerned about the safety of the seniors, because now, especially seniors who live alone, they're now isolated, and not everyone has family to support them. So they were making calls specifically just to check up, to make sure everything's fine. Our our social workers, our department, we collaborate with the county's adult protective services. So if we notice any issues or any suspicions, we will contact APS to do a welfare check just to make sure everybody's okay. Another thing that we've have all started switching to, not just our service providers, but also the department, we're trying to offer more activities online, either using things like Zoom or teleconferencing to do presentations. We also have service providers that are converting their evidence-based wellness programs into YouTube videos so that seniors can watch it at their leisure while they're in their own homes. And just for people who aren't aware of our evidence-based programs, these are all programs to increase the wellness and health of seniors so that in the long run in their lifespan, it'll delay the need of much more expensive and intrusive treatment. So we're talking about classes that teaches you how to manage your chronic conditions, high blood pressure, osteoporosis, diabetes. We have classes in fall preventions, which is very critical because after a senior experiences a serious fall where they could be hospitalized, they suffer serious health conditions within 2 years on average. So the better we can keep a senior healthy in their homes without suffering injuries, the longer and healthier life they'll have. So those are some of
James,
the other
so
things.
for somebody watching at home, how would they gain access to those programs that you're talking about? Where would they go to find those?
Of course, to our website, and we do, if they check our social media, we also send out bulletins of when those classes are held. They could also, of course, contact their local multipurpose senior center. We have 18 of them currently in the city. And I also just wanted to mention how appreciative we are of both the city council and the assemblyman, as a matter of fact. Prior to all of this happening, every year the council has always ensured that there are no waiting lists for meal services, and they always step up. So we have over $3 million of city general funds that supports our nutrition program over and above our federal dollars. Just before the pandemic hit, the state had awarded us an additional, I believe it was 1.4 million specifically for nutrition for a home delivered meal program to also shore up the increasing costs just due to inflation and everything else. So we were all preparing to implement that when this pandemic hit. So right now we're already working towards incorporating about the $2 million, I believe, that we're getting from the Family First Act. And we'll see about the next step, which is additional money from CARE Act that will run from now through December of next year. So it'll be a very interesting challenge to deal with the demands that we're now seeing from the senior population, and then dealing with our budget.
So thank you, James. And just really quickly, if a senior is at home watching and wants to find out more about either a delivered meal program or a grocery program, because a lot of seniors would prefer to cook their own meal, but they don't have access to groceries now. What are some of the, where can they go for additional information about those resources?
For those seniors who are interested in getting groceries, the LA Regional Food Bank is a great resource. We work with them, we do a lot of outreach, and actually a lot of local community-based agencies are partners with the LA Regional Food Bank, including in the Valley, both One Generation as well as San Fernando Valley Intercommunity. They're both associated with LA Regional Food Banks, and they do participate in distributing groceries. So seniors, if they have someone who could go and pick them up, that would be great. If not, contact those two agencies and see how they can arrange for a drop-off of those food boxes that they do prepare. Another service I'd like to mention is that every year we receive farmers market vouchers. It'll be interesting to see how this works out, but we will be getting those again this year. There are about $20 worth of vouchers, but when you're talking about buying fresh produce and fruits, that actually goes quite a long way to supplementing your groceries.
Terrific. Very good. And let me just add that anyone who wants to find out more about some of these city services can also go to paulkrekorian.org. That's PAULKREKORIAN.org. And we have a senior resources webpage there that provides that information as well. So thank you very much, James. I'd like to go next, certainly last but certainly not least, our partner in the County of Los Angeles. People sometimes, I think, don't realize that there are two distinct governments, the city government and the county government of Los Angeles, that perform some overlapping services, but mainly distinct services. But I'm so pleased that the city and the county are working in such close partnership right now to meet the extraordinary needs of this extraordinary time. And we have with us the Special Assistant to the Director of Workforce, Aging, and Community Services of the County of Los Angeles. And it's 10 million people. And I'd like to welcome Kevin Anderson here. Thank you, Kevin, for being a part of this. And I'd like, if you could, to start off, just give a quick overview of some of the major programs that you're working on to help meet the immediate needs of seniors during COVID-19. And then I had some specific questions for from some of my constituents that I'll give you now, and maybe you can integrate that in as well. Some folks who indicate that they're alone and they don't have access to a vehicle, so they'd like to know what kind of transportation resources may be available for them. What resources do you have for seniors who are living alone during the Safer at Home to meet their unique needs? And I think a very common issue now for all of us, but especially for seniors, is as we're at home, safer at home, a lot of times there's a sense of isolation and social isolation. And sometimes that causes people to have issues of mental health concerns when we're isolated that way. And of course, mental health is an area that the county addresses and is principally responsible for. So if you could touch on some of those issues and give us kind of an overview, we would appreciate it very much. Welcome, Kevin.
Thank you so much, and good evening. Just wanted to begin by thanking Councilmember Krekorian and his team for including us. We really appreciate the opportunity to participate. I also wanted to say it's an honor for me to be here, not only as a representative of the county, but also as a constituent of Councilmember Krekorian and also Assemblymember Nazarian. So I'm broadcasting to you live from Studio City here tonight. So great to be here and share the resources that we're making available to the community. Also just would like to acknowledge the City Department of Aging, which is a great partner, and we work hand in hand to meet the needs of our seniors across the city and county of Los Angeles. So James is a great colleague, and we just really appreciate all the work they're doing as well. Before jumping in, I just wanted to also briefly mention that May is Older Americans Month, in case you didn't know, and this is something that the United States and county has celebrated for more than 50 years, and so it's especially important that we take some time and acknowledge the tremendous contributions of older adults, who are often engaged in civic and volunteer causes, who take leadership roles in their communities and their faith organizations, who serve as mentors. And so just wanted to briefly mention that. The theme this year is Make Your Mark, and I encourage you all to post on social media. There's a hashtag OAM 2020 that you can use, and really most of all, just encourage you to support and remain socially connected to the older adults in your families and communities right now, even as we have to continue to physically distance from one another. As the council member mentioned, just wanted to briefly say about our agency, WEDAC's Workforce Development Aging Community Services is the lead agency for senior services and workforce development services in the county. We work with all ages from age 14 to older adults. Today, I'm going to mainly focus on the services we provide for City of LA residents. And some of the services that we provide are actually provided to city residents by the Department of Aging. So I won't really focus on those. In terms of that question on what resources do you have for seniors who live alone during the safer at home period, just wanted to talk about a few things. One is something called the Critical Delivery Service. And what is this? This is something that we launched last month, knowing that many seniors are staying at home and that the older adult population has had an increased need for timely delivery services. And so we launched something called the Critical Delivery Service, which delivers food, groceries, and other vital items to individuals who are unable to leave their homes. Who's eligible for this? Anyone who's 60 or older throughout the city or county of Los Angeles, or anyone with a permanent or temporary disability. And what we'll do is provide individuals up to 4 deliveries per month, totaling up to 40 miles. If you'd like to sign up for this program, you can call 888-863-7411. That's 888-863-7411. We're open Monday through Friday, 8 to 5 to take calls. So you can just call that number and sign up and we'll help you out. Another service I just wanted to briefly highlight that we provide is called LA Found. And this is an initiative that the county launched last year to help protect individuals with dementia, Alzheimer's, autism, and other cognitive impairments who have a propensity for wandering, because we found that about 60% of individuals with Alzheimer's and about 50% of youth with autism will wander at some point. And there was a tragic case of someone who had wandered from her family while visiting LACMA several years ago, and it sort of prompted the county and our Board of Supervisors to take action on this issue. So what we do through LA Found is we provide something called a Project Lifesaver bracelet that someone can wear, and it emits a radio frequency. And when someone goes missing, a caregiver can call 911, and the sheriff is deployed to conduct a search and rescue using a receiver specifically designed to track the bracelet. And our LA Found team will also work with families and caregivers to connect them to available resources and services that may be helpful. So this is something that's available to anyone in the county who has Alzheimer's, dementia, autism, or other cognitive impairment, who's also mobile and at risk of wandering or capable of wandering. And to access this, you can go to lafound.lacounty.gov. That's lafound.lacounty.gov. And you can do a short application there. We also have a phone number to call our LA Found team, which is 833-569-7651. That's 833-569-7651. And then I'll go on to the next issue you mentioned, Councilmember, which was you live at home and you have a transportation need. So we actually have a program and service that we provide, we call New Freedom Transportation, where we provide multiple transportation options for older adults throughout the region. So one is a taxi cab program, and we provide taxi cab rides to older adults. We also have something that's part of that called door assistance, which is where we'll actually help the older adult get from the vehicle to their front door, or even through the front door into their home if they need some extra help. And we'll provide trips to virtually anywhere someone needs to go, whether it's a medical appointment, a trip to the grocery store, visit to a family member. And we'll also, as with the other one I mentioned earlier, we'll do up to 4 one-way trips per month for an individual, totaling up to 40 miles. And these services are available 7 days a week. Anyone who's 60 years or older or has a disability can apply. And to sign up for this program for transportation, you can call 888-863-7411. That's 888-863-7411. We also have a website at newfreedom.lacounty.gov. That's newfreedom.lacounty.gov, where someone can go and apply online. And then the last thing you mentioned, you mentioned a little bit
Issues
about
of social isolation.
Yes, yes, thank you. Issues of social isolation and mental health issues. So I'll just mention a few things, and I know our colleagues at the Department of Mental Health have additional resources as well. But you know, I want to address this. You know, you've probably heard the idea that even though social distancing is the new norm, it doesn't mean we should stop being social and that we should stay connected. So, you know, one thing we're you know, suggesting is that just really try to stay connected with the older adults in your life. You know, connect with them via phone on a daily basis. Use Zoom, FaceTime, and other video chat platforms. You know, you heard James mention reassurance calls, and we're doing that as well with some of our programs. But the same thing is true for all of us as, you know, county residents and as family members and as community members. We should all be taking it upon ourselves to be active in making calls and connecting with the older adults in our lives. Another resource I did want to mention that we've been promoting, which is actually a state resource, is something called the Friendship Line California. And the number is 888-670-1360. That's 888-670-1360. And this is a line where someone can call if they're feeling lonely or anxious, or just, you know, really needs a friendly ear to connect with. And there's people on standby to talk to individuals, to talk to older adults, and to talk them through, you know, any anxiety or concerns they're having. And this line is open 24 hours per day. So, you know, encourage you to take advantage of that resource as well.
All right. Well, thank you very much, Kevin, for that overview. And if all of these programs are all on the county's website, which is, what's the county's website again?
Well, so you can go to, so everything I've mentioned, you can.
The main website.
Yeah, so there's lacounty.gov is the main county website, and the county has set up an overall COVID page, and there's a lot of resources there. All of the specific things I've talked about tonight are on our department's website in more detail than the county's, and our website is wedex.lacounty.gov. So those are both websites that I encourage you to visit and check out.
Great. Thank you very much. And thank you for the service that the county is providing for our seniors. And all of those resources and others are also linked at my website, paulkrekorian.org. And so people, if you missed any of these websites or phone numbers, you can go there and catch it. And as we close this forum, I just, first of all, want to thank, of course, Assemblymember Audrey Nazarian, James Dunn, Kevin Anderson. Thank you very much for the work that you're doing. Thank you for being a part of this evening's presentation. And, you know, we opened by talking about how COVID-19 has disproportionately impacted seniors and how seniors are most vulnerable. But I think we should close by also remembering that seniors are the strength of this country and our community as well. My own parents were of a generation that overcame the Great Depression, won World War II, built the great city that we now know and love. And we have seen hardship before. This generation of seniors has seen difficult times, and they've overcome them. And I think this is going to be one of those times that challenges all of us, but I think we can all draw inspiration and strength from the life experience that our seniors have had. And I think they will lead the way through this challenge, just like they have the challenges of the past as well. So I want to thank you all very much for being with us. And again, if anybody has further questions, they can contact me through my website, paulkrekorian.org, and we'll be happy to guide you through. Thank you all very much. Have a good day. Stay safe.